Hello, everyone. My name is Mike Milliard. I'm executive editor of Healthcare IT News. Welcome to this edition of CIO Spotlight. I'm here today with Novlet Mattis, who's the Chief Digital and Information Officer at Orlando Health. Welcome, Novlet. Thank you for being here.
Thank you. Thanks for having me, Mike.
So, you've got a somewhat unique title. Not everyone has, that extra word digital in there. So as Chief Digital and Information Officer, how do you define and differentiate those two terms there at Orlando Health?
Yeah, I'll start with the fact that I started as a Chief Information Officer. Have had this title at Orlando Health and in other companies for a while now. And last year, after we rolled out our Epic platform, speaking with our CEO, and really and truly seeing how the business understood the strategic importance of IT to the Orlando Health strategy and our strategic imperatives and the alignment there. And where other companies are going from a consumerism perspective, which is how we engage with our patients, our clinicians and caregivers, and even our internal team members, how we engage with them digitally, just like in the consumer space where, most people are engaging with their banks, Amazons, even the post office digitally. So healthcare has to be positioned to do the same thing, especially with the changes in our demographics, whether it's at your sickest, where people want to be, in their homes to be taken care of, or the millennials or the Gen Xers who would prefer to engage, on their phone to speak to the doctor for some of the more simple needs they may have.
As you well know, it's been a very busy couple of years. We're, entering into kind of year 3 of this pandemic. It's, February 2020 was kind of the start of it all. So you've certainly had a lot going on there in Orlando. We know Florida was certainly hard hit at different waves in this. What has been on your to-do list these past years, and how have you kind of balanced the twin imperatives of managing the pandemic and keeping, things up and running and innovating for the future there at Orlando Health?
Yeah, like any other healthcare CIO across the country, our to-do list has been very challenged. And you know how you can always have your to-do list and something just kind of flies in and reprioritize it, reprioritize your to-do list. That has happened to us, whether it's with COVID, right? Or one of the topics that if we get a chance, we talk about is cybersecurity, right? And how we ensure that the business continues when our systems are down. So our to-do lists have just been busy. Orlando Health in particular, we have been in a growth phase. Our strategic imperative and what we're focused on right now is to grow. Again, just like other healthcare systems. So as a matter of fact, our current tagline is 10 by 30, which is, Orlando Health desires, or our strategic plan is to be a $10 billion revenue generating organization by the year 2030. So that comes with, new entities that we're acquiring, whether we acquired 2 new hospitals, large physician practices, organic growth in terms of our current footprint, and then also other opportunities such as in ventures and innovations. And so those type of things just keep my to-do list going. But where we had to start was to make sure we had a really good foundation. So when I came in as a CIO and now as a Chief Digital Officer, when I came in, the big focus was on stabilizing our current state. So we got rid of disparate EHRs and revenue management and population health systems, and we implemented Epic. We also modernized our IT infrastructure. We had a lot of technical debt. And also from a people perspective, I also totally transformed the IT organization. So lucky for me, we were able to do some of these things to really create a foundation that allows us to be agile and flexible as these things either fly in and reprioritize my to-do list or to keep up with my to-do list.
What have been some specific challenges perhaps over the past 2 years? What have been some kind of gratifying success stories or wins? And, what have been some lessons learned that will kind of set you on a good course for the future?
Yeah, so gratifying, of course, is the fact that even during COVID, right, for the last 2 years, we stayed on track with our plan to implement Epic. And so we were able to successfully implement Epic and also integrate 2 new hospitals and extended Epic to these 2 new hospitals, replacing their systems, so that the organization has a line of sight end to end on what we're doing clinically and revenue wise. Huge wins, right? Another huge win, as I mentioned, is the fact that COVID hit us like everybody else, hit our EDs, hit our volumes, hit our surgery cases, all of these things. But and so the value of IT became very apparent when we had to pivot in a lot of areas, such as to make sure that we could virtually see our COVID patients and round on them. Whether we put, borrowed out iPads and place them on a pole, or, extend, the virtual capabilities we already had in place. The fact that we could do that and help to keep the business whole as much as possible, and to keep our clinicians safe and to take care of our patients in the community, that has been gratifying, because that's when really, as a technician and a technologist, you see what you do, how you impact patients, how you impact caregivers to do the job they need to do. You really begin to see the value of IT. So lots of gratification there. In terms of challenges and lessons learned is to always start small. Do not try to boil the ocean and start big. So for example, we're doing a lot in the digital space. We have so many different use cases and so many different problems that, we could solve with, the digital aspects of things, but we have to be careful that we don't, over promise and under deliver. So start small, pilot, use cases, make sure you have a sponsor on the business side, make sure operations is very much aligned with what you're doing, because we could deliver the best IT technology as always, but if operations if they're not ready for it, if they're not trained on it, if they're not ready for the change and adopting it, then it will all fail. So those for me are some of the, the continued, be careful when you do, introduce technology or try to change what the organization does leveraging technology.
You mentioned your growth plans. What else is on your to-do list as we look forward into 2022? What are you hoping to accomplish either tactically or strategically?
On my to-do list is to, again, in a very proactive way, make sure that we safeguard the organization, our technologies, whether it's the clinical technologies or the information technologies or the digital technologies, that we safeguard them from a cybersecurity perspective. And in the event, and when, it's not even if anymore, in the event, but when they do fail, like we just had with Kronos, not to necessarily call out one company, but that's on everybody's radar, every CIO's radar, whether it's healthcare or other, when a major system is rendered unavailable for whatever reason, that the business can continue. So business continuity, business resiliency is as important as, security, safeguarding from a cybersecurity perspective. So those are some big things on my to-do list, in addition to continuing to align and scale the organization with our capabilities so that they can achieve that 10 by 30.
I ask this of every CIO I talk to. What are some emerging technologies that are perhaps not in place there yet at Orlando Health, but that you've got an eye on and kind of intrigued by or excited about their potential for the future?
Yeah, definitely. In the digital space is to continue to see, what's out there. We have, if you remember, big data. So digital space and then data and analytics are a couple areas, because again, data and analytics is very much another foundational thing that we must have to be able to innovate, to be able to take advantage of digitization. So we are maturing in that, in terms of where we are, from data awareness all the way up to using data for insights and to drive decisions. So that's one thing that, it's not that we don't have it, but that we know we are being intentional about knowing where we are on the continuum of maturity, and be very honest with ourselves as to where we are, and then making sure we put the right investments and people in place. The other piece, as I mentioned, is to really understand what consumerism really means, what works and what doesn't, and have a mindset that because you start something, it doesn't mean you can't stop and say, this is not working, try something else. So we're always scanning the environment as to what's out there, what's available, what's emerging. And then thirdly, we make sure that whatever it is that we're scanning and that we're trying and that we're looking at that's new and may not even be on our platform, that it's a fit. It's a fit architecturally, especially from a data perspective. It's a fit in terms of it's secure and safe. And it's a fit in terms of it is not just a fad, it's going to be adopted by the business to meet our goals, whether it's, growing, in our finances, providing the right quality so that Orlando Health can be a top 100 hospital or even top 10 in certain things. So those are some of the things that we do, is to kind of just keep scanning and looking at what's out there and what will set us apart, and continue our reputation of being an excellent organization to give and to receive care.
Excellent. And speaking of Orlando, one great place and opportunity to kind of explore some of those technologies is HIMSS 22. We're about a month plus out from that, which takes place at the Orange County Convention Center, March 14th through 18th. You mentioned that you're hoping to attend. Presuming that you do, what are you hoping to see there? What's going to be on your itinerary as you look around the show floor, or the education sessions, or whatnot?
Yeah, one on the people's side is to begin to reconnect, in person with some of my peers and the thought leaders in this space. Also to take a look and see which vendors are really in a place that they will help us in terms of our strategy and our strategic alignment to grow and to provide us those capabilities that will fit into our platform, but will differentiate us. So I'm definitely looking forward to, a lot of the companies that talk about big data, talk about consumerism, that talks about security and all of that. Let's see what they really can do and who are the ones that are at the top. Of course, we are an Epic shop from a core clinical system. So I'm not looking at EHR vendors, right? Mm-hmm. So it's those vendors who really will differentiate us. That I'll be looking for, and just making those connections again in person.
It will be great. Thank you for taking the time to do this.
You're very welcome. Thank you for talking to me, and I might run into you at HIMSS.
I hope so. Yes. Maybe one other question for you is, as the kind of hometown team, so to speak, do you have any advice for things people should see when they're in town, or restaurants they should check out, or anything like that?
Yeah, one other thing about Central Florida, we are definitely a big tourist spot. So we have great restaurants, we have great things to see. I would invite people to spread out beyond, the convention center, beyond iDrive, and even beyond Disney and Universal, right? The usual stuff. Check out downtown. We have a vibrant downtown, great restaurants down there. Crest is one of my favorites. Or if you go beyond that to Sand Lake, we have good restaurants there. Christini's, we have the usual, Eddie V's. Ocean Prime is a great seafood restaurant. So just, again, I'm more of a seafood gal, so I can tell you about a lot of those, but they're also really good steak places. So I would invite people to spread beyond iDrive and just check out some of the areas, especially our downtown. Orlando downtown is amazing.
Looking forward to it. Can't wait to head down to Orlando, and I hope to see you there at the show.
Good to talk to you, Mike, and hope to see you too. Take care.
Thank you, Novlet.
Bye-bye.